kinds of things with them.
When it comes to keeping your teeth healthy, Abilene Dental knows just everything and anything. Last month, we covered what your kids need to know and do in keeping their mouths healthy. With me is Dr. Christy Leedy, who I haven't seen in such a long time. We are talking about veneers, but before we get into that topic, you had a coloring contest on your Facebook page as a little campaign, and you announced the winners, and we had the winners as well. So who are they?
Okay, so we have Lexi O'Brien, age 5, and Sam O'Brien, age 7.
Okay.
And then Trinity McLean, age 10. And all 3 of them will get an all-day pass to prime time.
So Lexi, Sam O'Brien, so brothers and sisters, and Trinity McLean. So if you guys watch our K-Tab commercials, the little boy that says Sam is the weatherman, that's Sam O'Brien. So he is such a good kid, and you know he deserves something like that.
That's
so
right.
such a fun
He did
contest.
such a good job too, so that was fun.
All right, let's get right into it, to the teeth of things. Veneers, that's what we're talking about.
Yes. You know, it was funny because last month was a lot about science. We had the heart and perio connection, and so I must have been having spring fever because I was ready for smile rejuvenation. Let's smile.
Let's smile, please.
So really, today we're talking about veneers, and veneers, you can tell, are just thin little porcelain facings. And the great thing about veneers is how versatile they are.
Okay.
And, you know, so now last month was more about the science. This is more about the art.
Okay.
So I love that part. And so as we're talking
Before
about...
and afters, keep around those.
Yeah. Okay, so here's some smile rejuvenation.
Got it.
And you can tell some worn edges. You might not can see some fracture lines, discoloration, those kinds of things. And this is the after.
How long was that process?
Okay, so this process took 2 appointments, but long appointments, because you have to get all the edges contoured. There's a lot of very exact detail that goes into it, and in customizing the shade and the shapes and all those things.
Okay.
So here's another one that has wear, discoloration, small spaces, and kind of the angulation also. So you can correct all types of things with veneers. And you'll see as we're looking, again, kind of the art portion of it, because each one's customized. Let me turn it this way. There we go. This one's larger spaces. And you can tell this was a patient that had orthodontics, and the teeth shape and size was too small. So we evenly proportioned them and then put the veneers to the exact right length and width, color, filling in the space.
So is it normally whenever there's the indifference with the shapes and the sizes that veneers is considered?
Yes, yes. And you can, each tooth, you know, you can take each tooth and customize it and trim it just the amount that it needs to be trimmed in order to get the end result that you want. This one has to do with abrasion and erosion.
Okay.
We're seeing more and more of that, Matthew, with soft drinks, Gatorades, energy drinks, and that type of thing.
What we talked about in the previous
Yeah, exactly. And so the teeth get so thin and so weak. So besides making them look better, it also helps strengthen them and make them more healthy.
And that all you can do.
That's right.
Dr. Chris Leedy, thank you so much.
Thanks.
It's been so long.
I know, I'm so glad to be back.
Anyways, you can make your appointment at Abilene Dental today. Just call the number on your screen or head to their offices of Buffalo Gap Road. Check them out on Facebook and Twitter. You never know, there's some future contests as well.